finished your presentation. So we should to move to another presenter is Ibu Dian Sukma Putri. She will present her presentations entitled The Effects of Mangrove Leaf Extracts, Coastal Bengkulu on Viability and Quality of Human Spermatozoa Chromatins. So Mbak Dian or Bu Dian.
Okay, thank you, sir. I'm
You have
sorry.
time for 10 minutes. Okay.
Dian Sukma is my student, so for
Okay.
presentation, I would like to presentation. I'm sorry.
Okay. Time
Okay.
for you.
My name is Lia Agustin Umar. Okay, thank you. For now, I want to presentation my research with my student in University of Bengkulu. The title Effect of Mangrove Leaf Extract, Sonentaria alba, Coastal Bengkulu on Viability and Quality of Human Spermatozoa Chromatins. Next. Okay, for now, mangrove, especially for Solentaria alba, dominate in coastal of Bengkulu City. Next slide. Okay. Okay, for background, Indonesia has a plan program for prevent population. So in general contraception in women, but for today, contraception for female is developed. So for female, contraception is spermicide and chemical based. So have a side effect, especially for increased change normal flora and increase genital tract infection. Next. So this is a form of hormonal male contraception. We know in common general, contraception. Ideal contraception must be for a long time and reversible. So for male, people use spermicide in condom. Next. Okay, background is mangrove Sonentaria alba is dominant on coastal of Bengkulu City. The leaf is plain are known to contain terpenoid saponin, which to describe the cell membrane of spermatozoa. Membrane disruption can affect to viability and chromatin quality of sperma. In Bengkulu, 5 species from 4 family mangrove, Rhizosporaceae, Rhizospora mucranata, and Brogorea cylindrica, family Avicenna, and family Rhisantrea, and family Combretacea. Next. Okay. This is assessment for chromatin condensation abnormality in of spermatozoa and evolution change of spermatozoa chromatin. We use aniline blue and toluidine blue stain for now condition chromatin spermatozoa. Next. Okay, this is a chromatin status assay. 100 microliters semen or ejaculate obtained from male patient and fertile donor to give sperm smear. For chromatin maturity, we use aniline blue staining and chromatin compaction. Or chromatin integrity, we use toluidine blue staining. From 200 sperm, clear staining percentage is maturation. On dark blue is percent immature. For chromatin compaction, toluidine blue staining from 200 sperm, light blue staining with means it's good compaction, and violet staining with poor compaction. So we use correlation analysis. Next. So the study I'm to analyze the potential of the leaf extract as a candidate for spermacide by looking its effect on the viability and chromatin quality of human spermatozoa. This research is laboratory experimental with a randomized block design or RBD. Next. Okay. We laboratory location in Faculty of Medicine and Biomedical Laboratory. Next. Okay, if you don't know mangrove or Solnentaria alba, we can see in this picture. So we use the leaf mangrove. Okay, next. Extraction by maturation, maceration method, and we test for pH and liberation versus Sonantari alba leaf. It's positive saponin terpenoid, terpenoid saponin. Next. For a sample population with married men in Bengkulu City, and we have six sample from 6 male for donor sample. Next. This is a sperm characteristic. We use World Health Organization in 2010, and okay, next. Okay, donor sperm will test this macroscopic and defined to 5 experimental group. Its sperm was ended to 0.9% NaCl as negative control, chemical spermicide for positive control, and treatment group extract 10 milligram per milliliter to 20 milligram per milliliter and 30 milligram per milliliter. All group for tests for viability and chromatin maturity. All sites slide this staining eosin, aniline blue, and toluidine blue. Next. Okay, statistical analysis we use Kruskal-Wallis. Okay, next. Okay, sperm viability we know the in this picture. So we have a picture in there. P0, positive, P1 and P2 and P3. This is extract in P1, P2 and P3. Okay, next. Okay, for observation in light microscopy and the form of presentation of stain and unstained spermatozoa head cell membrane. The results were analyzed in ANOVA following the Guncan test and the condition not met. So the cross-calculus is carried out. Sonentaria alba leaf extract can reduce the viability, chromatin quality of spermatozoa, and result of cross-calculus analysis has a significant of less 0.15 at men Whitney follow-up test for its concentration has a significant difference in the viability and quality of chromatin. Next. The concentration in 10 milligram per milliliter with 20 milligram per milliliter on chromatin maturity has not significant difference. The concentration of 20 milligram per milliliter was more decreased. Viability in 27.3, 75% chromatin maturity in 29.692%, and chromatin density in 32.04042% spermatozoa. Next. Okay, this is a sperm chromatin maturity assay. We use aniline blue staining result. Okay, next. Next, I'm sorry. Okay, this is a picture for Tolygene blue staining result. This is for assessment sperm chromatin integrity. Next. Okay. The same with next previous slide. So next. For conclusion, in Sonentaria alba mangrove, leaf extract can reduce the viability and chromatin quality of human spermatozoa. So that is spermicide potential. Next. Okay, thanks for LPPM University of Bengkulu and UPPM FKIK for grant, and thank you.
Thank you very much, Bu Lia, for kind presentation. So the mangrove leaf extract, right? So is there any common use for mangrove leaf extract in Bengkulu?
Yeah, because maybe not for drug, or maybe only for
Is there commonly used for food or kind of for?
No. Only for plain with coastal.
Okay, so but previous study, is there any previous study proof that the mangrove leaf extract is for kind of the purpose of your study? Is there any previous study that prove it for the quality of human spermatozoa in before previous study?
I'm not improve, but decrease quality, because this is for contraception. So
Okay.
I want to reduce maturity, not reduce maturity, reduce motility for spermatozoa, and reduce the we know the spermatozoa to die. So spermatozoa can be fertilized ovum. Yes.
Okay, thank you so much. So we have to ask the comment from Ibu Dr. Halimah.
Okay.
Okay, the time for you, Ibu Dr. Halimah, to comment the.
Okay, terima kasih. This is nice study because study for kearifan lokal from Bengkulu.
Yeah.
Jadi mangrove, can this be an alternative contraception ya?
Yes.
Yeah. What you advice do you give for researcher peneliti lainnya in kelanjutan dari studi Anda ini?
Okay. Thank you for Dr. Halimah. For then later on, I want to develop spermicide gel. So you prototype in spermicide gel. So I think it's less effect because the spermicide from herbal. And I think for next research, we can use volunteer, or we can see in targeted male. For now, for to know about side effect, maybe can follow after use this gel or anything. And we can develop a condom with natural spermicide gel from mangrove. I think this.
Okay, so the for the next step is Ibu Lia would like to formulate the products, right?
Yes. Yeah,
For the
right.
mangrove leaf extract.
Okay.
So, is there any questions? Other questions, Ibu Dr. Halimah?
I think step tahap pertama karena di masa pandemi ini banyak pencinta kucing, mungkin bisa diterapkan untuk kontrasepsi untuk hewan-hewan kesayangan.
Okay.
Thank you.
Okay.
Yeah,
Mungkin
thank you, Dr.
I think I can answer this.
Okay, it's fine.
Tadi
You are
in bahasa because I'm
no problem. Even in English, it's fine.
Okay. Mungkin kalau jawabnya dalam untuk hewan sepertinya agak susah karena ini tipikalnya untuk membunuh sperma yang dalam bentuk sudah keluar. Tapi kalau misalnya hewan, dia akan sedikit sulit karena kita tidak tahu mau meletakkan ini di mana. Karena kan kalau hewan mereka tidak punya waktu kapan mau kawinnya. So I think it's very
That is
difficult
the
for
consequence for
gitu.
limitation of that.
Yeah.
But is there any preliminary study, Ibu Lia? I mean, is there any previous study that proved in vitro analysis or in vivo study for this extract mangrove leaf?
Maybe because sorry. Mungkin karena ini apa namanya tuh
So this is the
langsung
first time.
Yeah, this is first time, and before kontrasepsi kandidat kontrasepsi untuk kandidat kontrasepsi ini biasanya menggunakan hewan coba. Jadi menggunakan mas, mencit atau yang lain sebagainya. Cuman perbedaan is different in this study is we use human spermatozoa.
Okay, but even that you use very limited number
this
of samples.
Because it's a very close for human.
Yeah, I mean,
condition.
so far I know that you presented that the sample that you use is around 6 patients, right?
Yes.
Around 6 people, right? So
only 6 patients.
So I think the suggestions for the next researcher to increase more and more samples, right?
Yes.
To widely know about the or validation of the mangrove extract leaves. Okay. And my suggestions, I think, is Ibu Lia, I think you should to have to find out because if you would like to submit it into the paper, into the journals, I think some of the reviewers will comment about the gap of the study. The gap of the study, because you started from the mangrove leaf extract, so you did not using the in vitro or in vivo study, or even that you can using the in silico analysis or bioinformatic based approach to see whether the candidate of the extract leaf mangrove is very important for to increasing the quality of the spermatozoa, kind of that, right?
Okay, thanks.
Better to do that. So for the
Thank
gap that for the gap of your study. So for my second suggestions, I think Ibu Lia, you can describe more data visualizations.
Okay, yes.
So data visualization is very important if you would like to submit it into the journals, especially in the methodology part.
Okay.
So right now, there is website, online database, online website that you can utilize, you can use. Like you can use BioRender, you know that BioRender, right? BioRenders, you can use that even that. Yes.
I think I can learn with
okay, you can contact me if you would like to.
Yes.
After this, you can contact me.
Thank you.
Yeah, you can using that. So your data, the readers will more easier to understand our study if we using the figure or if using the image. You
Yeah,
can
yeah, I
see right now the very
Yes.
good journals. Every journals right now asking authors to describe or to provide the image for the graphical abstract.
Okay. Yeah.
Yeah, kind of
Thank you so much.
my suggestions for improvements of your study and
Okay.
improvement of your papers. Thank you, Ibu
Thank
Lia,
you
for
so
your
much. So much.
Thank
okay.
you.
Yeah.
Bye. So thanks once again to Ibu Lia Agustin Umars for very
Thank
good
you.
presentations. And for the
Serviali.
next presentations will be Tony Cortis Maiboda. He will present about the antimicrobial activity and diabetic wound healing's effect of guava and Melastoma malabatricum leaf gels in rats, in spray daily rats. So, Bapak Tony.
Okay, thank you.
Okay, the time for you runs